I just thought it was important to bring this message out there. Recently, a study was done by one of the very famous researchers in a university in London, and that study is actually showing that depression is a condition which is not caused by a chemical imbalance, especially that of the serotonin. And this study is questioning the validity of antidepressants, especially the SSRIs. For those of you who don't know what SSRIs are, they're also called serotonin reuptake inhibitors. Most of the antidepressants, especially in this day and age, that your psychiatrist or your provider prescribes you are of that class. So after that, many other studies came out, review articles came out, and psychiatrists as well as other researchers spoke up and said that, hey, we never thought that depression was just caused by a chemical imbalance. In fact, not just depression, but many other psychiatric conditions are caused due to a combination of biologic, psychologic, and social or environmental factors. We can have problems in relationships. We could have a lot of stress. Something may not go well in our lives. There could be a prolonged grief, a death in the family, trauma, for example. All of these factors also contribute into causing that of depression. When we psychiatrists give medications to patients, we don't tell them that, hey, take this pill and that's it, your depression will be cured. That's not the case. There are many other factors which are very important for helping a person manage his depression and come out of that depression. Psychotherapy, counseling, or therapy is so important and has been proven to be so effective for depression. Then there are so many other things that we have our patients work on to help them with this depression. We lay stress on exercise, diet, eating the right kind of food at the right time, self-care, aromatherapy, mindfulness, meditation, developing a hobby, establishing good and healthy connections, staying away from people who bring you down who are toxic, creating a nice work-life balance, establishing a proper sleeping schedule or a sleep cycle or a healthy sleep routine, or developing a hobby, engaging in sports. So all of those factors combined together can help a person come out of that episode of depression, not just one pill. And that's very important for us to know. So if there are folks out there who are on medications and are doing very well, and you read the study, then please share all these concerns. Take this study to your provider and say, hey, this is what I read. What do you think about that? And then, take guidance from your doctors. And if you are going through an episode of depression and your doctor wants to give you a medicine and you are skeptical because you read this study, then again, go ahead, read some other studies, get a second opinion, talk to your counselor if you already have one, and then use it as a team approach. Talk to a supportive family or a friend and say, hey, my doctor wants me to take this medicine. What do you think? So do your study, do your search, gather all the facts, look at the bigger picture, and then make the decision. Please don't make the decision based on just this one